بسم الله الرحمن الرحيم. موضوعنا اليوم في الجنرال anatomy muscle of mastication, that muscle that related to doing a mastication of food in the oral cavity. There are 4 pairs of muscle around the upper and lower jaw. This muscles is first Mesita muscle, second Temporalis muscle, third lateral trigoid muscle, and the last one medial trigoid muscles. The common characteristic feature of all muscle of mastication: all are inserted to the mandible. All are innervated by mandibular division of the trigeminal nerve. All are concerned for biting and chewing. Its function of muscle of mastication: to move the mandible, to secure then stabilize the mandibular position, to determine the direction of mandibular movement. This is for all muscle of mastication. The first muscle is Mesita muscle. Its location at the side of the ramus bilaterally. All muscle have an origin or more than one origin, the insertion and more than one insertion. So the Mesita muscle have 2 origin. The origin has 2 head: superficial head from anterior 2/3 of lower border of zygomatic arch, and the deep head from medial surface of zygomatic arch. This 2 head is go downward and insert in the mandible. So the insertion of it to the lateral aspect of the ramus to the angle of the mandible. We have 2 insertions. The first one is superficial head to the lower 2 half of the ramus, but the deep head to the upper half of lateral surface of the ramus. This is the insertion of Mesita muscle. You can see in this figure the red one is the origin and the blue one is the insertion of the muscles. The blood supply are from maxillary artery by mesenteric and deep temporal arteries. Is a rich blood supply to its action. The other blood supply is superficial temporal artery by transverse facial and middle temporal and facial artery. This artery is anastomosis within the masseter muscle, so its action is very strong. So need refuse blood to supply the muscles. The action of the Mesita muscle is to raise the mandible to occlude the teeth in mastication. So it's elevate the mandible upward and put the mandible in the occlusion surface. The second muscle at the side of the head is the temporalis muscle. The origin of temporalis muscle again from 2 heads. First, bony floor of temporal fossa, and it is superficial one, and the deeper one from the surface of the temporal fascia. So it is its origin from the bony part of the temporal fossa and the fascia of the temporal fossa, temporal fascia. So it is origin of the temporalis muscle. It go downward and insertion within the colonnade process and other insertion in the anterior border of the ramus of the mandible. So its fiber is go downward either vertically or obliquely to the colonnade process and anterior part of the body of the ramus of the mandible. The blood supply, again, it is very rich blood supply. The first one from axillary artery by 2 branch is mesenteric and deep temporal artery, and second one from the superficial temporal artery by two branches are transfacial and middle temporal artery, and the other supply from facial artery. So it is within, like Mesita muscle, the temporalis muscle is rich to its action of the unit mastication. The action of temporalis muscle is how depends on the fibers. The anterior and superior fiber elevate the mandible, and the posterior fiber retract the mandible for posteriorly. So, temporalis muscle, its sole function is to elevate the mandible and crush objects between the molar or carverners to clench to the other animal using the canine fang teeth. The third muscle is lateral trigoid muscle within the floor of the skull. Its origin of lateral trigoid muscle have two origins. The first one is smaller upper head is from the infratemporal surface of greater wing of sphenoid bone, and the larger bulky lower head is from lateral surface of lateral trigoid plate. So it is two heads like the masseter and like temporalis muscle. The insertion of it first to the trigoid fovea at the neck of the mandible, and second to articular disc of the temporomandibular joint and to the capsule of temporomandibular joint. So have three insertions: the upper fiber to the trigoid fovea of the neck of the mandible, and to the articular disc and capsule of the temporomandibular joint. The action of lateral trigoid muscle depends on the fibers that pull the neck of the mandible forward with articular disc during the opening of mouth, with medial trigoid of the same side pull the neck of the mandible forward and articular disc causing the jaw to rotate around opposite condyle as in chewing. This have the action of lateral trigoid pull jaw forward and strain trigoid plate of the sphenoid as in sinuses and septums. The last muscle is medial trigoid muscle. The origin of medial trigoid muscle have again two origins. The smaller superficial head is from maxillary tuberosity and pyramid process of palatine bone, and the larger bulky deep head is from medial surface of lateral trigoid plate. So its origin from superficial head as maxillary tuberosity, lateral surface or pyramidal process of palatine bone, and the deep head from trigoid fossa and medial surface of lateral trigoid plate. Its origin go to the mandible of the insertion of the medial trigoid muscle within it to the medial surface of the angle of the mandible, to the medial side of the ramus at the angle of the mandible. The blood supply is of the middle and lateral trigoid muscle is from maxillary artery. The action of the medial trigoid muscle assists in elevation and rotation of the mandible on both sides. The innervation of the medial trigoid of muscle of mastication. The nerve supply of all muscle of mastication is from the mandibular division of the trigeminal nerve that have the mandibular division that have divided into two branches, anterior branch and posterior branch. Anterior branch is mainly motor, except long buccal nerve is sensory. The posterior branch is sensory, except the mylohyoid nerve that supplies mylohyoid muscle is a motor. This figure shows the innervation of the muscle of mastication by mandibular division of trigeminal nerve. This branch give mandibular division give many branches, intracranially and extracranially. Intracranially give meningeal branch nervus spinosus and middle meningeal artery that pass within the foramen ovale. Outside the cranial cavity give auriculotemporal nerve and mesitatic branch, deep temporal nerve, buccal nerve, nerve to lateral trigoid, nerve to medial trigoid, and cordia tympani is backed up within lingual nerve that supplies the submental ganglion that give within cross 8 lingual artery and go downward to the nerve to minor hyoid, also supply the anterior berry of the gastric muscle. The main trunk of the mandibular division of the trigeminal nerve is give medial trigoid nerve, nerve to tensor tympani, nerve to tensor villi palatine, and the posterior trunk give branch to auriculotemporal nerve, lingual nerve, inferior nerve, and minor hyoid nerve. The innervation of mastication, muscle of mastication is muscles. The masseter muscle innervation by masseter nerve from the anterior trunk of the mandibular nerve is the third division of the fifth cranial nerve. Temporalis from deep temporal nerve, the anterior trunk of the mandibular division, the third division of the trigeminal nerve. Middle trigoid is innervation from nerve to the middle trigoid from the mandibular division nerve, the anterior division of branch of the fifth cranial nerve. Lateral trigoid, nerve to lateral trigoid, directly from the anterior trunk of the mandibular nerve or from buccal branch of the trigeminal nerve, the fifth cranial nerve. This table shows a muscle of mastication. Its muscle is a masseter, its origin zygomatic arch, insertion lateral surface imus of the mandible. At action, elevate mandible to occlude the teeth. Second one, temporalis, from the floor of the temporal fossa, its insertion chronic process of the mandible, its action anterior and superior fiber elevate mandible, posterior fiber retract the mandible. The lateral trigoids have two heads, lateral ophenoid and lateral trigoid plate, its insertion neck of the mandible and articular disc, its action pulse neck of the mandible forward. Medial trigoid have two heads, porosity of maxilla and lateral trigoid muscle plate, and insertion in the medial surface of the angle of the mandible. Its action is elevate the mandible. All this muscle is innervation by mandibular division of trigeminal nerve. We have accessory muscles that assist in mastication of food. The first one is the mylohyoid muscle. It's a sheet of muscle that form the floor of the mouth. The other muscle is thyroid muscle. It's branch is muscle that form the suprahyoid muscles that have above the hyoid bone. Its origin from the thyroid process and insertion in the hyoid bone. The digastric muscle. We have two digastric muscles that have joined by the digastric villi. This is anterior and posterior digastric muscle. Genohyoid muscle, that is one of the suprahyoid muscles that have its origin from inferior genal tubercle and insertion in the upper part of the body of the hyoid bone that form part of the floor of the mouth. Thank you for your listening attention. Any question later.